Let's talk about Botox. It saves lives. No, actually. So, what is Botox? Botox is the.
Botulinum toxin or botulinum toxin is a neurotoxic protein produced by the bacterium Clostridium botulinum and related species. Do you want me to keep reading?
No, no, I'm good, Siri, thank you.
Okay.
She does a better job than me. So, what is Botox? Botox is actually a brand name for botulinum toxin type A. It's a purified protein derived from the bacterium Clostridium botulinum. When we inject it in teeny tiny little amounts, it blocks the release of acetylcholine at the neuromuscular junction. This means the muscles cannot contract, so they have to relax. Now, most people are aware of the cosmetic use of Botox. Most people use it to smooth out dynamic wrinkles in their forehead, smile lines, frown lines, crow's feet, or whatever. It takes effect within 3 to 7 days of the injection being given. It peaks at about 2 weeks and it lasts anywhere up to 4 months in most people. However, studies have shown that people who are more active or the more you use the muscles, the faster that it metabolizes. Additionally, you can become allergic to Botox because you can form antibodies against the Botox toxin. And with repeated injections, it actually becomes less and less effective as your body learns to clear it faster and faster. This means that when we have repeat injections or we need to give large doses, we actually need to increase the dose with prolonged use. Aside from its cosmetic use, Botox actually has a lot of uses in medicine. We use it in neurology, urology, dermatology, gastroenterology, and pain medicine. In neurology, it's often used as a prophylaxis for chronic migraines. This just stops the teeny little muscles from spasming that would otherwise bring on a migraine. It could be used for cervical dystonia as well as involuntary eyelid closure. It could be used for hemi or full facial spasticity after a stroke or multiple sclerosis or cerebral palsy. In urology, it's often helpful in overactive bladder or detrusor activity, especially in patients with spinal cord injury or multiple sclerosis. In gastroenterology, it can be used to relax the lower esophageal sphincter in a condition called achalasia. This is the tiny little sphincter at the bottom of your esophagus that feeds into your stomach. When it's too tense and too tight, it stops food and water passing through. Additionally, it can also be used in the treatment of anal sphincter overactivity, which causes chronic fissures. Probably my greatest interest area is in pain medicine. Sometimes we use it for neuropathic pain or myofascial pain syndromes. Somewhere I personally have seen it most heavily used is in patients that have traumatic brain injuries or are otherwise bedridden for a long time and have spasming muscles. It helps to relax these muscles so that they can untense and they can relax and feel more comfortable. Now, just a comment on the safety aspect of botulism toxin in a hospital use. When we're applying this as a medical intervention, we use much, much higher doses than you would ever use in a cosmetic situation. And it's generally well tolerated and has mild, very localized side effects. Usually it's just bruising, pain at the site of injection, or maybe a little bit of unwanted muscle weakness. However, rarely it spreads beyond that target site and it can cause dysphagia, which is difficulty swallowing, ptosis, which is unwanted drooping or closing of the eyes, and even systematic weakness in rare cases. The TLDR of all of this is botulism toxin, or Botox, is actually a wonderful medical tool and it's not all about cosmetics. It's a protein that can improve the quality of life of patients who have debilitating conditions and spasming muscles, as well as softening wrinkles. So whether it's helping somebody walk more comfortably after a stroke, or relieving years of migraines, or giving somebody a slightly smoother forehead, Botox is a fascinating example of science applied to real life.